This is the last lecture on the topic how to treat diabetes type 2, and I'm going to talk about exercise, lecture number 5. Let's go. The best exercise to lower your sugar is cardiovascular aerobic exercise. And I do not care what you're going to do. You're going to do it in the water, fine. You're going to walk, excellent. You will do Pilates or yoga, all fantastic. Just keep doing that. What you need to know that you need to do 40 or 60 minutes every day or every other day, and to bring your heart rate according to your age. Only then the sugar will go low. Okay, guys, that's it. You understand? It's aerobic cardiovascular exercise. I am done. The rest of the video is explanation for people who wants to understand. Why do you need to do aerobic? Okay. Why they just cannot go? Like one of my client told me that I had a client a couple of months ago. It actually was mom and daughter, two of them. Mom had a diabetes type 2 that she had a difficult time managing with metformin. So daughter organized the appointment with me. What I did, I talked to mom, tried to figure out where's the problem. I thought, maybe there is vitamin deficiency. Maybe there is mineral deficiency like chromium or magnesium. So no, the diet is pretty good. Then I said, maybe digestive tract is not. No, digestive tract is excellent. So then I told mama, it's a lack of exercise. Mama just not going to take it. She said, well, I we live in the house that has 2 stories and bedrooms are there. I often from the second floor to the basement to do the laundry 2 or 3 times per day. I have a Fitbit. I have enough steps. I also go once per week in the park to do Tai Chi. I'm not going to buy it. I said, it's a lack of exercise. I felt that appointment did not go well because mama just did not want to hear. But to my great surprise, 2 weeks later, the daughter texted me that she and mom decided to go to walking vacation for 2 weeks. So 1 week they plan to spend in the cities and walking there, and the second week walking in the nature. And they are going to test my theory that you don't do that, stop and go up and down. You do cardiovascular, you just keep walking. So I get updated. On day 1, they had about 6,500 steps. And next morning, fasting glucose was 100. The second day, they get about 7,000 steps. And the next day, fasting glucose was 99. As they walked every day, blood sugar, fasting glucose never went higher than 99. Mom was extremely pleased. Now she understands why. Now you need to understand. Let's go to a PowerPoint. Let me just go there. So you need to understand that when we eat sugar through different chemical pathways enters the mitochondria, and in mitochondria it goes into a Krebs cycle, also called citric cycle. And sugar, as it's broken down, release the energy, and energy comes in form of NAD, fat, and goes into storage into ATP. ATP is a storage. Okay, so let's go now to the blackboard, and I will elaborate more on this topic. As always, I already pre-drew my favorite picture of the digestive tract. This is mouth with the teeth, esophagus, stomach, small intestine. This is the large intestine, and we go to the bathroom right here. As we put sugar into the mouth, remember, it does not matter for our digestive tract. You put simple or complex carbohydrates. Complex carbohydrates are better because it takes time to digest, so the sugar is not going to spike. But for purpose of digestion or absorption and utilization, it does not matter. Sugar is the sugar. So here is the piece of sugar, finally in the small intestine, get absorbed through the digestive tract into the bloodstream. And this is the bloodstream. This is the pipe. And this is the bloodstream. As piece of sugar get absorbed, insulin get released. So this complex sugar insulin goes inside the cell, here is our cell, this is the nucleus, and this is our cell. And inside the cell, we have a mitochondria. So it goes into the mitochondria, and inside the mitochondria, it goes into the Krebs cycle. So let's draw it here. So through different chemical pathways, it gets converted and it enters Krebs cycle. And as sugar gets broken into the Krebs cycle, recall that slide that I show you, the energy gets released. Okay, and that's energy is used by our body. So suppose this cell is a muscle cell, and here is our muscle. Okay, this is our, let's say this is our muscle, this is muscular fibers. So this is this muscle. As we keep exercising, we need energy. Muscle needs food in form of nutrients, and it needs water, it needs oxygen, and it needs energy. And this is the energy that comes right here. And the energy comes in form of not fat, and from the storage is ATP. Okay, so we are exercising and energy is used, meaning that sugar that get absorbed through the digestive tract and floating here, that sugar get directed into the muscle cells, into the mitochondria, into the Krebs cycle, and the more we exercise, the more sugar we will consume in form of energy. Now, suppose that client of mine, a lady, 70 years old, she went from second floor to the basement, put laundry, and is standing there and washing and looking at her wash machine. All right. So running down there, those muscles were exercising. So she was using this energy. The circle starts to spin, telling, oh, we need the energy. Then she's standing there. So muscles are exercising much less. So you don't need that much energy. Okay, where's this energy will go? It will go into storage, to ATP. Unfortunately, to store energy in form of ATP is extremely expensive for our body. Body does not do that. So we have very limited capacity of the storage. When the storage get full, because she was exercising, stop and go, the circle was spinning, filling ATP storage. Now it's full. What it does, when she stops, she comes to the kitchen and she sits down. Okay, again, muscles are not working. What happened, this ATP gives a feedback, since storage of energy is full, stop spinning the wheel. I don't need energy anymore. I don't want energy. Signal goes back into the bloodstream, but the sugar concentration is still here because she ate some carbohydrates. They're still absorbing. The sugar concentration goes here higher. Energy is not using because she is sitting or watching her wash machine on the basement. Okay, what will happen to the sugar? That sugar will go into other storage, and that other storage is liver. Liver has a very limited capacity. About 100 grams of sugar could be stored there, 100 grams. What happened if, she had a big sugary meal and sitting there? Well, the storage is full and liver cannot take it anymore. Sugar is still high here in the bloodstream and keep absorbing. Sugar is high, where will it go? It's go and get converted into fat. Okay, that's how people who have diabetes type 2, or that's why, let's say it correctly, that's why people who have diabetes type 2 usually have extra fat, because they do not exercise correctly. They do that stop and go. So the idea is do it cardiovascular exercise. Okay, so that means that the storage of ATP is never full. Okay, so there is no feedback telling stop converting sugar through the Krebs cycle into energy. I hope, guys, this is clear. If something is not clear, please ask me a question. By the way, I want to tell If person exercising regularly every day or every other day, that has a positive cumulative effect. So the storage from the liver is depleted, fat starts to deplete. Okay, then suddenly something will happen. And let's say you just cannot exercise for several days, if weeks, okay, because the storage facilities are depleted, okay, the body will use that sugar and put it into ATP, into the liver, and then it will start to deposit all into fat. So several days a week, it's the effect of exercise will be seen as a positive. So it still will be kind of you will be losing weight. The blood sugar will remain low. Okay, guys. Now, finally, bye-bye.